what you think are the changes that need to be made in order to improve health equity for people who are living with or affected by HIV?
Oh gosh, a powerful question. Yeah, I think we need collaborative systemic change. And it isn't just surface level interventions. We need to embed cultural humility and anti-racism into healthcare training, and not as an optional module, but as core competencies. We need to ensure that data is collected and then used responsibly. I think, to highlight these disparities and inequities and drive targeted action and reflection. And then representation matters. It's more Black clinicians, researchers, policymakers shaping the response to HIV. They don't have to be the only people, obviously not, but they need to be at the table and be given a voice and given space, should I say. And then, really quickly, it's the social determinants as well. Housing, employment, mental health, these all intersect with HIV outcomes. And crucially, amplifying the voices of Black people living with HIV in decision-making spaces. The whole mantra of nothing with us, about us, without us, that's true health equity. And it'll only become evident if it's built into every level of care, policy, and society, I'd say.
Yeah, no, absolutely. I would agree with you 100%. And for too long, engagement has felt really tokenistic, that people from Black communities are just brought in at the end when the decisions are made as a tick box exercise. And we've seen these interventions aren't working as a result of that. So, we need the change now.
Truly. And we've got to learn from the fact that we're not where we want to be. And if we're not where we want to be, why aren't we there? And are we not doing the things that we know to be good consistently? Or do we not know what we need to do? And that takes active reflection.